Okay, welcome back everybody. I'm just going to give everyone 30 more seconds. So I see all my panelists have their cameras on, which is excellent. Welcome all, so good to see you. Great, I'm seeing cameras coming back on and folks rejoining. So please have a seat. Don't want to miss this next section. It's going to be really incredible. We have a really wonderful panel of expert presenters. Okay, so I would now like to introduce Freddie Garcia. He's a long-term United Way volunteer and an amazing member of our community, as well as our truly phenomenal panel made up of advocates and experts in the housing field. Freddimir Garcia is the Northern Regional Director for Diversity, Inclusion, and Community Engagement at the Westchester Medical Health Network. He's an active member of the community, serving on various boards that include Catherine Street Community Center, Family Services, RUPCO, Pattern for Progress, and Rhinebeck Bank. He's a two-time Marist graduate and holds a Diversity Inclusion Certificate. So I would now like to welcome Freddie, and I'll ask him to unmute himself, as well as my other panelists, and we will begin. He is going to be moderating our housing panel.
Good morning, everyone. Excited to be here. Melissa, thank you for the introduction. As it was said, my name is Freddie Garcia, and I have the pleasure of leading today's discussion with our 6 panelists who are the experts around the topic of equity in housing. Before we start, I do want to encourage everyone to use the chat box for questions. You know, we're here today for you and for this dialogue and discussion around equity in housing. So I really encourage participation in that way. You know, I would rather be overwhelmed with questions than have no questions. So fire away as we go along. So today, again, is a focus, you know, we'll be focusing on the intersection of equity and housing in our community, the challenges presented, and how can we, you know, together as a community move forward and move ahead. Rather than me introducing every panelist, I'm going to call your name and then please introduce yourself, a little bit about, you know, who you are, what you do, who you work for, and the communities that you work with here in the Hudson Valley. So let's first start with Sabrina.
Hi, good morning, everyone. So my name is Sabrina Marzouka, and I am currently the Commissioner for the Department of Community and Family Services in Dutchess County. Traditionally, I think those departments are called DSS, you know. We like to change the name to really reflect what we do, which is all about community and family services. So I was actually born and raised in Haiti, the Caribbean island. So I was pleased to hear our guest speaker from the Dominican Republic, which is where my father is from. So that was cool. So when you hear a strong accent, or if I say something slightly French, that's probably due to that background of mine. So to talk about housing, I don't know that I consider myself an expert. I don't think anyone really is. It's such a complex, it truly is a very complex topic to discuss. But I thought maybe I could talk a little bit about what local social service departments do when it comes to housing and somewhat the way we work and what we have to offer. So it's typically known as temporary housing assistance. I always say that we work with one free hand. The other hand is tied with regulations, and those regulations, I think, when you start zooming in, I think you will find that there's a lot of equity issues around those regulations, and that could be a topic in itself. Having said that, there are really two ways that we provide assistance. It's the rental assistance, and then it's emergency shelter. It's very general. There's a lot of small pieces into it, but generally speaking, just for our purposes, you can think about it as those two options. So somebody presents homeless or at risk of becoming homeless, and we try to assist. It's all income-based. It's all income-based. But the very interesting thing is the cash assistance, the dollar amount that somebody can qualify for or a family can qualify for, there is no way that it's sufficient for you to afford housing. I mean, it's just not, what is $400 for an individual going to do for them to find appropriate housing? Maybe a room, maybe. I mean, the housing market is very tight, but in addition to that, it's we don't have affordable housing. That's just the fact, right? So it makes it very difficult, and most counties can apply for what we call a supplement, so that we can increase that cash assistance to make it somewhat more, realistic as to the market in your community. When you see one social service department, you see one social service department. Even though we have the same programs that we have to administer, there is a variety in the application. So for example, when it comes to supplements, some counties have had the supplements approved for ages and ages, and other counties have none. In Dutchess County, I applied for a supplement for singles and obtained that for 85% of the market values. So that has assisted us a lot. I have also applied for families, and it's been running into 3 years now, and I'm still waiting for approval. So until we have that approval, our hands are tied. And that's what I meant by you work with one hand assisting people, and the other hand is kind of, tight based on regulation.
So Sabrina, before we jump a little bit further into it, let me get the other panelists to kind of just introduce themselves, and then we'll kind of jump into exactly, I think, a little bit more in terms of what you're referring to. So Javier, if you want to kind of introduce yourself real quick.
Yeah, sure. Hi, everyone. Good morning. I'm Javier Gomez. I work with Hudson River Housing. I am a program coordinator with the real estate development team there. So my work is mostly involved in creating new housing, new construction, renovation, and also major improvements to property that Hudson River Housing currently operates. So I'd probably be able to speak mostly to any in this conversation. I'm hoping to get involved in anything about, the challenges with creating new housing and what that world is like right now.
Thank you. Patience?
Hi, good morning. My name is Patience Hughes. I'm an attorney, housing staff attorney with Legal Services of the Hudson Valley. Legal Services of the Hudson Valley is the only organization that provides free legal services in the Hudson Valley. And we serve low-income people in our service area. I am one of the 2 dedicated staff attorneys serving Dutchess County. So, the resources are not that many, but we do represent tenants in 23 town and village courts and 2 city courts, City of Poughkeepsie and Beacon City Court. My work is primarily focused on eviction prevention through litigation in a housing court, trying to negotiate settlements to, either keep people in their homes or trying to negotiate for them if they live in private housing, having to walk away owing as little as possible or nothing at all, and then helping them with transitioning to other housing. We also represent tenants who live in subsidized housing, so project-based Section 8, people with Section 8 vouchers, people who live in public housing. And so we do this either through court, if there's litigation going on, or through administrative hearings. And the main purpose is so we can preserve, this housing, because, as you all know, affordable housing is very, very, very rare. We also do know your rights training for, tenant rights. So we partner with community organizations, serving our area, training people on their tenant rights. And I want to say that I'm excited to be here. And my work personally as a housing staff attorney is made possible by all the partnerships that we have with all the people that are on this panel, DCFS, Hudson River Housing, Catholic Charities, Community Action, to name but a few. Without them, we wouldn't be able to assist our clients, not only retain the housing, but find, affordable housing, retain, so, what everyone here does is really great. And I think the partnerships just help our community at large. Thank you.
Thank you, Patience. Colin?
Yes, good morning. My name is Colin Jarvis. I am the Executive Director for the Newburgh Ministry. And the Newburgh Ministry has been around for 37 years, starting out as a grassroots faith-based agency whose essential mission was to really stand in solidarity with folks who exist on the margin and help them through whatever struggles and obstacles that they might have in their lives. I'm proud to say that in recent times, we are really jumping into the midst and really looking at creative ways to deal with what I refer to as a pandemic of housing, certainly in the city of Newburgh. And I'll speak a little bit about that and the impact that COVID has had. But I am honored to be a part of this conversation. And I hope that at the end, when it's all said and done, we're walking away refreshed and energized and really convinced that we have to do things differently. Thank you.
Thank you, Colin. Terri?
I'm Terri Torchio. I'm the Director of Economic Independence for the Orange County Department of Social Services. So as a commissioner from Dutchess County said, we deal a lot with temporary housing, placing people in temporary housing, moving them on to permanent housing, also doing what we can to maintain someone's housing. If we, for example, if we can pay back rent to keep their housing so they don't become homeless prevention that we talked about in the first place. So there's a lot to it. There's a lot of regulations. There's times that the regulations are relaxed, such as in the upcoming Code Blue, which should be within the next month, I would think. We'll talk about that a little bit if people aren't aware of exactly what Code Blue is. We are working, I'm very, very fortunate to have a really, really strong partnership in Orange County with many of the different entities that also work with people with housing. We have a very strong COC here in Orange County. We have a very strong strategic planning committee that is an offshoot of the COC. So I'm really happy to be here today so that we can talk about all of those things and form more relationships that, working toward keeping people in safe, affordable housing as much as we possibly can.
Thank you, Terri. And last but certainly not least, Hector.
Good morning, everyone. I'm the Director of Social and Human Services here at Catholic Charities of Orange, Sullivan, and Ulster. Catholic Charities is a multi-service agency that provides addiction services, prevention services. We have a pantry in Ulster. We also have a resource exchange program that's under me, immigration services, and we also have a parish counseling network. I'm over what's considered the safety net services of Catholic Charities. And our program includes the Housing Resource Center, and that's a collaboration with DSS, Terry's team, and case management services, and we also have a small food closet here at 280. But we do have a full operating pantry over in Ulster, Ulster County. Our case management services supports families and individuals with funds for eviction prevention, first month, and rental arrears. So we that's our role in the community, and we service in Orange County. We go from Newburgh all the way to Port Jervis.
Thank you, Hector. And it's interesting, one of the things I kind of picked up fairly quickly, how we ended the last session about community and collaboration is exactly what you see within this panel. The work between different organizations, government entity and organizations in our community, and community with organizations. So I think you'll see that more and more as we kind of get into the discussion. As you all know, we're certainly experiencing a lot of challenges across the nation with COVID, the social unrest, and the shifts in our environment. So this question, for Terri and Sabrina, with all that's happening with COVID at this moment, I can only imagine that it's certainly hitting certain populations harder than others in terms of the housing crisis. Can you speak to those effects? Those suffering from substance abuse, mental health, domestic violence, kind of bringing all that together from your perspective.
So you want to go, Terri?
Sure. I mean, what we're seeing right now, and I'm pretty sure that most counties are seeing the same thing, but I can't speak for other counties, is we're seeing a slight decrease in homelessness right now. Believe it or not, you wouldn't think so, but we are. And that's really because due to the eviction moratorium that is in place until the end of the year, at least. So right now we have, because normally a huge percentage of the people that we see as homeless are homeless because they've been evicted. And a lot of people, of course, living in poverty are on the edge of eviction, and it takes just one small occurrence to happen for them to fall into an eviction type of situation. Right now, that's not happening, but that's going to happen. So what we're looking at and what we're really concerned about is how to reach people that are there, but for the eviction moratorium, they would be homeless, because we know that that's not going to go on forever. We know that landlords need to get paid so they can also pay their taxes, and that things can go on the way that they're supposed to go on. But right now there's a lot of unknowns with us, with what's going on. We don't know when the moratorium is actually, we know when they tell us it'll be lifted, but it's been extended several times already. There's some guidance that isn't always clear as to when we can begin to assist. So there's a lot of different initiatives that we're putting through in Orange County to try to address that, aside from just DSS, but working as a larger consortium and trying to address what we feel is going to be an avalanche of homelessness come the beginning of the year.
So yeah, I would agree with Terri that we are also seeing a slight decrease in the numbers. And again, we also think that it has to do with the eviction moratorium that's out there right now. I would say, however, that what we have noticed, particularly in our overnight emergency shelters, we have seen a lot more clients who have serious mental health and substance abuse issue. And sometimes they just have a mental health issue, sometimes they just have a substance abuse, sometimes both. And it has made it a lot more difficult to serve them. They are not engaging. They present very often under the influence, or they are not taking their prescribed medicine. They are refusing treatment, and that makes it very, very difficult to engage them, Terri mentioned Code Blue in her introduction, and Code Blue is basically a lax, if you may, of the regs, which enables us to serve everyone without restriction when the temperature falls below 32 degrees. Now, again, this is where I say it's interesting, you know, your right hand is working, your left hand is held behind, because if you think about it, I can assist you when the temperature is less than 32. So it's less than 32 on Monday, and then on Tuesday, it's, I don't know, 38, and I can't help you. It's just crazy. But that's the kind of environment that we manage, that we deal with. And as Terri mentioned, one of the things that we are also working on is utilizing some of the federal money that have come forth through the CARES Act, dealing specifically with COVID. We are putting money away, say, you know, so that we can address eviction prevention with rental arrears. We anticipate that individuals will have rental arrears, and you know, while the eviction moratorium is out there, yes, it's true, it's not stopping the court system. So basically what's going on is people, and I think our attorney can talk about this a little bit more. So basically a landlord can still take you to court so that they can do the process of the eviction proceeding. While you can't physically be removed from the property, the system is still working. And I think what I've seen from legal services, the latest information I've gotten from them, and I appreciate their partnership in keeping on top of this, is that the courts are sort of like looking at your case and trying to identify if you qualify for that moratorium. And basically it's there, and it's just waiting for that moratorium to stop for the eviction to proceed. So as Terri said, we are expecting an avalanche, and we're trying to set parameters in place so that we can work with our partners. So United Way actually is one of our partners we are going to be working with to set up the 211 as a central call in Dutchess County, where people who are facing eviction can make a phone call, and we can sort of quickly triage and identify which program you would qualify for, because everything is income-based and everything has, you know, eligibility criteria, and direct you to that system so that we don't duplicate and we maximize all of the resources possible. But my biggest concern personally is that we haven't seen, this is the tip of the iceberg, we haven't seen what's coming down the pipe, and the concern regarding the fragility of the individuals that are really suffering, not just from the lack of housing, but from the lack of treatment, the lack of availability of treatment, frankly. Everything is telehealth. So if you don't have access to a telephone or to a computer, how do you access your treatment? So we are seeing definitely mental health and substance abuse being serious barriers to stable housing, even when assistance might be available.
Thank you, Terri and Sabrina. You know, and it's, you know, it is critical to have kind of a one place to call. I mean, I know there's a lot of issues that families and communities are dealing with. So again, just to remind folks that at Dutchess County, you can dial 211 for information, and in Orange County, 311. So can't get any simpler than that, in my opinion. Hector, I'd like to kind of bring you into this conversation, talk a little bit about you know, the COVID impacts, obviously with housing, but for the undocumented community and families in Orange and Dutchess County.
So I think what we've seen is that, you know, there's a group of people that are going to be left behind. I think these are a group of people that won't recover and don't have a platform on where to climb out. And in the hole that they currently find themselves. We've seen a tremendous need in the community. As far as Catholic Charities and some of our partners that are on this line, actually, we've put together pop-up pantries to meet the need. We've supported families through providing them funds. One of the things that I was looking at some of my information in Orange County. We provided about 39,000 between 39,000 in relief support to families, and some of that funds went to undocumented families because they have no resources to support them. And that's that. I think very early on, I'll tell you a story. I think it was right around June. So if you think about it and you put it on a timeline, most of us on this call were pretty much in lockdown in the month of March. These families continued to work because they had no other recourse. So by the time June came along, I was receiving calls from families that were already in lockdown, already quarantined, had a grandmother, as a matter of fact, called me and talked to me because she was having problems meeting her medical bills. And of course, she's undocumented. Her other 6 family members, which were together, holding the home together, were also sick. And all she wanted was help with the medical bill because they were charging her. I guess she had gone into one of these community clinics, and they actually charged her about $500. Now, for all of us on the line, we know that during the month of March, COVID testing was free, right? It was supposedly. So, but that was the thing. That was something that was impacting the family. So this grandmother was not only dealing with no one being employed in the home, the landlord threatening to kick her out, but also trying to cover her medical bills. And on these families, I think, are the ones that we really have to watch out for, because there's no catching these families, you know. And I think that's kind of the struggle. And landlords can threaten these families very easily. And that's, you know, that's one of the things that we're kind of like trying to stay ahead of, and informing landlords and using our legal partners, legal services of Hudson Valley, our immigration partners that we just happen to be blessed and have here at our location, to help us have these conversations with these landlords and say, you can't threaten these families, you can't evict them. But as we mentioned, once this moratorium is over, what is going to be the picture for these families?
All right, thank you, Hector. And it's certainly a challenge. You know, we are talking about equity and housing, but what we do realize too is that there's, you know, compounding issues on top of that, that don't allow people to kind of gain or search for the appropriate resources as they navigate these tough times. And I think, again, that's why it's even more critical for partnership, collaboration, because again, every organization can do what they can. I think together we can do more along the way. Colin, how about the effects on COVID has had on the homeless service providers, organizations like yours, and trying to meet the services of the community?
I'm going to answer that, and I you know, because I'm a person that like to kind of give a stab at solutions. I hope you don't mind if I speak about that as well.
Absolutely.
So what we've seen, you know, since March is that we've had to begin to dance on a dime, right? All of a sudden, there was this thing called COVID-19, and so we had a shelter in place, and we have to lock down, and our normal services that we would provide to the community, in addition to our homeless services, you know, it was sort of like under siege. So we had to close our drop-in center and the whole 9 yards, but figure out ways to continue to serve the community. What we've seen in terms of homeless services at the 2 shelter facilities that we run, which is Winter Haven 1 and Winter Haven 2. Winter Haven 1 is our emergency shelter. That, you know, obviously, you know, the increased length of stay, just because people had no real other options. And as a shelter provider, we had to dance on a dime. So I had to add additional staffing to be able to cover 3 shifts rather than 2. So it's a 24/7 operation. And we went from not feeding people to feeding people. But the other thing about that is that we have a community that we have been responsible for in some sense for 37 years. And so when people call you and tell you they have no food, I don't have the luxury of saying, oh my God, I'm so sorry to hear that, but there's nothing that we can do. So we have had to leverage partnerships with all our community providers. And I applaud, folks like Recap and Catholic Charities, who has been tremendous for us, right? So as Hector mentioned about folks undocumented and not having resources, I mean, through the help of the Archdiocese of New York, we were able to help some of these folks with just basic food and basic survival, keep the lights on. Here's a bag of groceries or whatever, what the case might be. These, as I said before, COVID-19 has really just accentuated the pandemic of housing that has been with us since the 1960s. And I urge folks to go back. There's a YouTube video that's called The Battle for Newburgh, 1960, that featured a city manager. His name is Joseph Mitchell. I urge folks to go and have a look at that as a way to contextualize our history and our battle with this notion of decent, affordable housing and the crises that still persist up to now. All right. So as COVID-19 has really put additional stress and strain, we got to find other monies to make adjustment and social distance folks. We got to really figure out a way out of this. And it's our, Nadi was on earlier, it's our collective responsibility to be able to do that, because at the end of the day, we're still failing in critical places. And so I just want to just share a couple of things with you, right? Here's where the crisis lies. Let's look at the numbers. A studio apartment in Newburgh rents for, on average, $969 a month. A one bedroom, $1,073. Two bedrooms, $1,346. Three bedrooms, $1,721. Four bedrooms, over $2,000. Folks who are on fixed income, and our folks from Department of Social Services can really articulate this much better than I can. You have a person who's getting SSI, SSD at $750, $850 a month. Folks, do the math. It does not add up, right? And so we're left with this gap of housing, affordability, decent, and available. So we know that there is this distance between reality and desirability, right? And this is what we face. The housing blueprint that works, right, in poor communities is a blueprint that has to do with supportive housing. Okay, and we can see that in terms of the supporting housing structures that we have, those entities that provide supportive housing, whether it's through whatever the subsidy source might be. But here's the reality too of what that is like. And I just read this a little bit. You have in the city of Newburgh, Kenny's apartment, for example, right, which is generally subsidized, a waiting list of 2 to 4 years. Okay, Independence Square, facility that just that's run by Independent Living, waiting list 2 to 3 years. Mason Ridge, another new housing development within the last 5 years, their waiting list is 8 years. Cornerstone, City of Newburgh, 6 months. So what are we talking about here? We're talking about, right, a crisis that if we don't get to the solution phase of it, we'll be speaking forever about what the problems are and what the problems are. It has to be a collective, a collaborative between public-private partnerships. We got to develop more subsidized housing, whatever that takes, in order to solve the problem. And then we got to look also at our economic infrastructure to see how we can shift the movement of that to be able to support an economy in a poor neighborhood that is healthy, or begin on the path to becoming healthy.
Thank you, Colin. And to kind of continue on that point, I want to bring in Javier into the discussion as we think to talk about, development, housing development perspective for the future, and what the challenges might be. Because I think, obviously there's been a gap in housing pre-COVID. COVID obviously is moving us to a different direction. So kind of what's your take on the development, future development of housing in both counties?
Yeah, well, I guess I did want to respond kind of to like the conversation that's been had already, just to show a different, another side to the coin, like a more perspective to what you guys are all saying about the way that COVID has impacted families and the way that families are falling behind on rent, falling behind on bills. One thing that we're also seeing too is that, the larger landlords will be fine and kind of make it out of this. But there are, in our region, there are a lot of small landlords that own maybe like 2 units of 2 apartments or at most 3 or 4. And those are the landlords that we don't really know how they're going to make it out of this either. There are resources, there's loan products available to help landlords. But even right now, what we're seeing is that a lot of landlords who are smaller, they don't really know if they're in a position to take on a loan. And so, as bills are not being paid for like a variety of reasons that we're all talking about, there is this like ripple effect on the small landlords in our community. And that is a big portion of our housing stock as well. And like what you said, Freddie, we were in a housing crisis before. We already don't have a lot of available affordable housing. So that's a part of the dynamic too, that I think I'm worried about, that people are worried about moving forward. What does this all mean for that chunk of our housing stock, the smaller landlords that might not be able to make it through 2021 based on what's going on? And I guess just to continue on what you were saying about housing solutions, like I said, we were in a housing crisis before this. And so the bittersweet thing that I've been seeing a lot is that a lot of solutions already exist. There's a lot of people in our region who are working on solutions to housing that COVID has just accelerated the issue. It's created an urgency around the issue, and we know that things have to be done sooner than later. But the plus side is that I think in a lot of ways, we know what we have to do. I think about there in Poughkeepsie, there's the Poughkeepsie Affordable Housing Coalition. Based out of Newburgh, there's the Center for Housing Solutions that Pathways for Progress has. I think there's a lot more groups that I'm not even aware of, but a lot of these groups have these conversations about inclusionary zoning coming about. There's already inclusionary zoning that exists in Beacon, I know of, and I think that in other communities we're talking about that more and more. There's land banks in Newburgh, in Kingston. Now Dutchess County is working on creating their land bank. At Hudson River Housing, we recently got a planning grant to look at how to develop a land trust. And so we're in the early stages of that. But with all that to say, we have to kind of lean on that I think we have a lot of experts in this area that know how to deal with the challenge that we're in. It's just about recognizing the urgency that we have right now.
And what we see again is the similar issues across the Hudson Valley. Every municipality, I think, is dealing with this in terms of housing construction, affordable housing, and what's the balance, and how do we assure that things are available for the people of our community. The one of the underlying things that I think obviously kind of continues to come up without being said also is, obviously there are access issues and there are issues with discrimination as well. So I want to bring in Patience to kind of talk a little bit about from a housing attorney perspective, what are the issues that you're seeing out there in terms of discrimination and access? And then also, what can we do and how should we approach it with our clients as we work along with them through that process? And I think, Melissa, you have to unmute Patience. Sorry.
Thank you. Well, I would like to build on what everyone has said. Even pre-COVID, we were facing, affordable housing is just very limited in this area. And even with the subsidized housing, low income housing, it's just not enough, right? So I want to say that, I know many people have talked about the moratorium and all that. Like, I don't want to talk about that as well. As of October 12th of 2020, cases are going on. So the court is handling eviction matters. Even before then, the pre-COVID cases, we were having conferences. So, we are, housing court is in business, if I could say that, right? So even with the moratorium, like Sabrina had said, you do have, it's not blanket. So it's on a case-by-case basis. You have to prove that you have protection under the Tenant Safe Harbor Act, under the CDC order. You have to prove financial difficulty, right? Thankfully, it's not tied to COVID anymore. It's just, blanket financial difficulty during this time period. And so what that means is that, if the court determines that you are protected and, you should, not be evicted until after January 1st, which is the date that we have now, that does not prevent the court from entering what they call a money judgment. So, a money judge, a landlord can still act on a money judgment. And again, I'm talking generally because, again, it depends on a case-by-case basis, whether the arrears are pre-COVID, which is pre-March 17th, or after that period. So, and again, what I would say is, you should advise, all your contacts, the people that come to you for assistance, to contact legal services so we can, advise them accordingly. And one other thing I would like to say is that, the rent is not forgiven, so it's still owed. And as a housing attorney, it keeps me awake. I don't know what's going to happen, come January, right? Not only an avalanche of evictions, but it's just like, are we going to let, people in our community become homeless? So those are, the concerns that I have with regards to that. Moving on to the point of discrimination, there is, housing discrimination. It's not, sometimes it's not overt, it can be very, very subtle. Both the federal law under the Fair Housing Act and the human rights, New York human rights law, they prohibit discrimination in housing based on, race, religion, disability, lawful source of income discrimination, and many other things. You can't discriminate on housing, whether it's letting, renting or selling. It's illegal, right, in the state, in the country, but I'm talking about New York State specifically. And we do encourage, people, like if you say, I'll talk about lawful source of income discrimination, right? So this means that for our clients, people in our community who have, say, Section 8, you have a Section 8 voucher, or you have a fixed income. We have many people who have, SSI, or your rent is paid by public assistance, DCFS pays your rent. And, you reach out to a potential landlord and the conversation is going on right. You make an application for an apartment, they tell you it's available, and things change when you say how you're going to pay your rent. So that is housing discrimination based on your lawful source of income, right? It shouldn't matter how your rent is getting paid as long as it's a lawful source of income, right? So in things like that, we do, when we have clients who go through these issues, we do help them file discrimination complaints with the New York Human Rights Division. We're also currently partnering with, different agencies in the service area that do fair housing. So the Fair Justice Housing Council, they do investigations, they do testing, they do litigation. So, and they've been able to get, good results for the, people who have been discriminated against in housing, whether because of their race or, sexual orientation, income, things like that. So we do encourage, people to, reach out to us. And, in the past, when landlords would put out, say, like adverts for apartments. You know, they could say Section 8 not allowed, or we don't, families, right? We want only single people. You know, you can't discriminate on, you know, against someone just because they either have a subsidy or they have children, you know. So with the laws that New York State has passed, including there was a housing law passed in 2019, which afforded tenants in New York more protections, you know, I think landlords are now aware, like, you know, so it's not very overt as, you know, as it used to be. But, you know, anyone can tell, you know, when this is happening. And so we do encourage people not to be silent, you know, because if it's happening to you, it's happening to someone else and it should be addressed. And we've also seen things with, you know, when people with disabilities, right? We've had a couple, you know, quite a number of cases recently with, you know, people who have, you know, disabilities, and their apartments are not providing them like designated parking spots, right? So things like that, we've been able to, you know, advocate on their behalf, and, you know, they've gotten these parking spots. You know, if you're able-bodied, you know, you would think it's, you know, it's something, you know, it's simple, you just walk to your car, but it's different when you have, you know, a disability and you require, say, something, you know, like if you get a parking spot that really, where you don't have to walk like for, you know, a long, I don't know, 5 minutes, I don't know. Yeah, so, so things like that. And so basically, I cannot like talk about like specifics. I'm just giving different examples because everyone has a different experience. However, if you're in this protected, you know, this, if the state protects you and this happens to you, definitely it's something that we would want to, you know, address, and make sure that your rights are protected. Yeah. And there's so many barriers to access to housing, financial, like everyone has said before me, we just don't have enough affordable housing, right? So I even pre-COVID and now post-COVID, I don't know, there's rising rents. You know, it's really, I found it really surprising to me that during this financial crisis because of COVID, people lost their jobs, they had no income, the rents were just rising. In Dutchess County, I have many clients who call me and say, I'm trying to find a place, I cannot afford an apartment, right? Landlords have been raising rents. I've had like tenants who were in Section 8 and the landlord is like, well, I can get, I don't know, $500 extra, $800 extra for your apartment. So I'm going to raise your rent to such an amount that your maximum shelter allowance for your voucher would not pay, right? Most people, unfortunately, live in private housing. So if you live in a private house, the landlord can raise your rent, right? There's no law against that. The law just says that if a landlord is going to increase your rent by more than 5%, they have to give you the notice, you know, a requisite notice, depending on how long you've lived in, you know, in your apartment. So it can be a 30, 60, or 90 days. And once they give you that, then, you know, that's it. Like all you have to do is basically find a new alternative. And what people are facing is that new alternative is really, it's not there. It's very rare. So these are things that, you know, we're facing. Many of my clients are facing that, and, you know, just coupled with everything going on with COVID, just the stress of trying to find an apartment that you know you cannot afford, and then you're just worried about being evicted, right? So even when you go to court, you know, once the court process is over, like, you're still gonna have to move. And so I think, yes, we need to find solutions. Otherwise, we're going to talk and talk and talk. I know that Sabrina was talking about, you know, the shelter supplement, like for people who are in public assistance. You know, I think Orange County has that, and, you know, Dutchess County has that for singles, and, you know, I think Sabrina said that they're still waiting on approval for their families. So that would be great if we got something like that. And I know this is only in the city. I think it hasn't come up. It just from Worcester to New York City, they have rent stabilized apartments. So tenants have a right to a renewal lease every year, and rent can only be raised a certain amount of time. Amount. So it can't be that much, which is good. So it keeps people in their homes and they don't have to worry about, you know, what our clients up here have to worry about with, you know, they don't have security. If you live in a private apartment, you're not entitled to a lease, and the landlord can just decide to terminate your tenancy, not renew your lease, and there is nothing that you can do about it. So I know with their, you know, localities would have to vote on, like, you know, whether they want this rent stabilized apartments. So maybe that's something for the community to engage in, people who do community organizing, tenant organizing, you know, all stakeholders, to see if that's something we would want for our communities to, maybe as one of the solutions, you know, for affordable housing.
Yeah, no, thank you, Patience. You know, there's, I certainly, which kind of ties to my next question, but before I get to my next question, I do want to put a plug that obviously, you know, shelter and housing is a human right. And as, you know, in terms of reaching out, feel free to, I think, you know, Naudi would agree with me to reach out to Orange County Commission on Human Rights or the Dutchess County Commission on Human Rights. I think as a member of the Dutchess County Commission, I think, you know, part of what we want to do is also inform landlords on some of this information. As Javier said, a lot of them, you know, have started this in very small ways and are navigating it as a different journey for them. So I think it's also kind of our due diligence to communicate what are the laws of the land per se, right? And what are the do's and don'ts, and how can we support each other in our community along that process. So for my last questions, before we get into some of the questions from our audience, you know, I'm a person that likes to do things. So I tend to go to a webinar or a session, and I kind of leave motivated, and I want to change the world one day at a time. So what I will pose to our panel is, what can we as individuals do to support these efforts? What can we do as an organization that we may be a part of? And what can we do as a community together to kind of move the needle forward in terms of equity, access, and housing as we, you know, continue to move forward? Obviously, COVID isn't going anywhere anytime soon. We know what the new year will bring. So with all that, what can we do to better the situation of housing in our communities? So I'll kind of let whoever wants to jump in at this moment. You can either raise your hand or just jump right in. And I think Hector and Terri, you're still muted. So if you need to be unmuted, just say so. Oh, yep, you can unmute them if you can.
Okay, in Orange County, one of the things that we're working on is really a coordinated response with all of the stakeholders here in Orange County. So, and this is, we've been doing a real lot of work around this, where community development, and I know Nicole is on the call. We've been working with, we're keeping our CARES Act funding in-house, and we're, you know, trying to figure out the very best way to get this out to, people in need, whether it's rapid rehousing or eviction prevention, as soon as possible. We want to identify people as soon as possible that have needs, so that they never have to go through the homeless process, which we know is just incredibly, which is incredibly, stressful for people, and just so disruptive for people that are already going through what they're going through, in children and families, and people with mental health and substance abuse issues. We're just dealing with all of that, and we want to make it as seamless a process as possible for people to get assistance. So one of the things that we are looking at through our COC, our Strategic Planning Committee, too, is to have kind of a centralized response where stakeholders, say anyone that might have a pot of money, because there's many people that have different pots of money with different eligibility criteria, but instead of sending a person, say, listen, I can't help you with this, DSS, because we, have a pretty low level of income, needed to be able to assist. But, maybe Catholic Charities can help, or maybe Jewish Family Services can help. So instead of doing that, kind of bringing everybody to the table so that we can talk amongst ourselves about eligibility and who can assist as a panel, say, as a SPO, a single point of access. And I think that when we talked about this Monday, that Dutchess is doing something similar, where we're taking it more upon ourselves to make sure that people that are already overwhelmed aren't given 20 different places that they have to run around to get assistance. And I would say that even if the people that don't have a pot of money to expend, still you're the ones that are seeing the people. You're the ones that are working on the front lines with folks. So we want to be able to get information out to everybody as to how you get your consumers to be able to access the dollars that are available. And when we're looking at the CARES dollars, and we're looking at that particular funding that's aside from DSS funding, we are looking at vulnerability indexes, and who, speaking to what Anadi was talking about before, who's been the most impacted by COVID, who are the most vulnerable families and individuals in our county, and putting them kind of up higher on the list of people that we need to immediately assist. How long they've been homeless, what vulnerabilities, which maybe living in a area that's been particularly hard hit by COVID. So I think I went off topic a little bit, but there's just so much involved in what's going on right now. So I apologize for going off topic, but
no, I think you hit some great points about obviously collaboration, being able to share information within each other. I think obviously we all know that we try to cover all bases, but we can't. We don't have the resource to. So how can we partner a little bit stronger to address that collaboratively? I think that's really kind of the sense that I got from your comments. So I appreciate that. Anyone else?
Yeah. So from my perspective, just to simplify it, I think I agree with a lot of what Terri said. From an agency standpoint, what can you do if you're an agency? I think the bottom line is join the conversation and connect to your housing consortium. Every county has a continuum of care consortium. And if you're interested, or if you serve a population that is dealing with homelessness, then you need to be at the table. It's just that simple. Because the key is really to do this collaboratively. One individual agency working on its own is not going to be as effective as everybody coming together and sharing their resources. So that's from an agency standpoint. I think from an individual, I'd like to touch on something that we haven't touched about or discussed yet, but I think we need to speak out. I think we need to practice what we preach as an individual. What we see a lot, and I'm sure you all will shake your head and say, yeah, that's true, is everybody wants to do something for the homeless, but you'll get not in my backyard, right? That is a problem. And when you have these types of issue and you talk about affordable housing and you need affordable housing, the way our zoning is structured, the way our communities react when you want to have affordable housing within that particular community is an issue. So from an individual standpoint, I think it's important to speak out and to really address this form of serious discrimination. And unless we start doing that, I mean, we are just gonna keep revolving the cycle. That's my personal opinion.
Thank you, Sabrina. Absolutely. We have to dismantle kind of those biases that, you know, kind of live within each of those groups that we talked about today. And focus on educating ourselves along the way to be able to share that with our colleagues and community.
I'll add, and I was gonna just chime off. Sabrina basically said something that I was thinking about as well. I feel like the one thing that we can all do is like educate ourselves more about the community-wide benefits of affordable housing. And just to correct those misconceptions, I think there's a misconception that affordable housing is only for people of low income, only benefits low income people. And and Audi talked about those social determinants of health. That's a really, really good example of the way to think about housing as a community-wide benefit and affordable housing as a community-wide benefit. So I think that the more we can learn to talk about those issues, we can deal with those misconceptions. Because I'll just say from our perspective as developers, we're in those rooms, we're in conversations with people who really don't understand housing. So it's real that there's a lot of people out there that have that stigma. And I think we all need to get better at addressing it when it comes up so that we can move faster and move forward.
Yeah, man, appreciate it. So Melissa, let's kind of get to some of the questions that have been posed. I unfortunately have not been monitoring it rather than paying attention here. I see 63 comments. There's no way I'm going through all of those. So I will defer to you.
Freddie, I just messaged them to you privately. I don't know.
Oh, perfect. All right. So I will try and.
So far.
Okay. Let me give me 1 second, folks. So we have one here. Will CARES Act funds have different income eligibility guidelines for emergency assistance to prevent evictions or rapid rehousing?
Yes, it does. It's a different income, but I can't remember what it is. I don't know if Terri does, but yes, it is different.
The CARES Act money that we have in the county is the COVID monies, and that's 30%. Nicole, please let me know if I'm incorrect, but that's 30% of AMI. There's also funding through community development, and that goes up to 8% of AMI. And is specific to the city of Newburgh, I believe. So when we're looking, there's all different levels of funding dependent on what program you're applying to, and that's why I had mentioned that it's so important. And as Sabrina had said, you know, we're doing all this through the COC to try to enable people to understand what they're actually eligible for, instead of having people spinning their wheels, because unless you're immersed in this every day, as some of us are, you're not going to know. You're not going to know, you know, what you may be eligible for. You're not going to know if maybe you can, you know, get back rent from temporary assistance, which is where you're start. I don't know what that is, but so yeah, there's many different eligibility levels, and that's why I think that both Dutchess and Orange are looking at doing a SPOA or a single point of access type of model so that we can assist people in navigating that.
Thank you, Terri. Next question. This one's for Javier. You know, with the cost of construction materials and construction in general, is that impacting the ability to build new affordable housing?
Yeah, definitely. That's one of those things that's been going on pre-COVID. Like construction costs have been going up in this region, probably around the country for years now. But now with, you know, we were already in a housing crisis. Now we need, it's even more urgent. But yeah, we still haven't dealt with that issue of construction costs and the way they're rising. And I would say really the impact again for that, it specifically affects a lot of smaller and local developers. Costs are so high that it's very hard for like natural affordable housing to like occur. Like if you just want to, as a person, want to buy a building and develop affordable housing, or buy a vacant property and renovate it yourself and fix it up, when you get through the construction, you definitely will have taken out a loan, and the numbers aren't going to work for you to be able to rent your unit affordably, based on just the construction costs. So Hudson River Housing, we're one of those. We have the benefit of being a large affordable housing developer. We have the capacity to apply for state funding and get subsidies that make it so that we can take out construction loans. It's still very expensive, do construction at a high cost, and then we get a state subsidy to pay that down. So we're able to operate our units affordably. That doesn't work for smaller landlords that don't have the capacity or the know-how to access state funding. So it makes it, you see what I'm saying? It makes it really hard for someone who doesn't have that ability to access state funding to develop affordable housing if the costs are going to be as high as they are.
Thanks for that response. The next question, so this is to the entire panel. So the person wrote, I'm curious about the panel's perspective on a guaranteed minimum income. Is it a useful concept? Sorry, it's moving here. Is it a useful concept to consider as part of the solution, or is it distraction from the more immediate efforts needed? And I'll open it up to anyone on the panel.
Can you repeat it one more time? I think I missed the first part of it.
I'm curious about the panel's perspective on a guaranteed minimum income. Is it a useful concept to consider as part of the solution, or is it a distraction about the more immediate efforts needed?
You know, in some ways, I think it's a distraction, because people making $15 an hour are still not going to be able to afford a decent live in Orange County. It's just, unless they're working several jobs. And I think that this is what the conversations we have all the time, right, Colin, too, we just have these conversations that, even we have so many people that we work with that are out there working every day, and even making, minimum wage or even $15 an hour. I think it's still going to be very difficult because of the lack of not only affordable housing, but also working class housing, people making, people making, low earners, basically.
I think it's a larger conversation, having to do with what's the economic balance, right? So, a minimum kind of, or a set income pattern in and of itself it's great, but if the other economic indicators are through the roof, right? So, cost of living is through the roof, the rents are so incredibly high as we're seeing them in like the city of Newburgh. If the other things are out of balance, then that doesn't really begin to solve the problem. We really have to, it's a meeting of the minds, with government, but with private ventures in terms of how do we balance this, right? So for example, if landlords in the city of Newburgh are paying through the teeth in terms of taxes, right, then in order to balance their budget, the rent has to be a certain, at a certain level. And if it's outside of the margins of the area median income, then we have a problem. And this is essentially what we are seeing, that there is an imbalance, and we got to really come to the table. Subsidized housing certainly helps the scenario a great deal. But we got to really speak about the larger issues, right? Having to do with employment, unemployment. What are the rates in the city of Newburgh? How are we attracting new businesses? How do we balance that in terms of what's happening? And then we have the fluid movement of folks. Folks are leaving the city, coming up, and they're buying the real estate, and you can't blame them, because it's an economic opportunity. How do we keep our finger on the pulse? And this is what we need to begin to start talking about and collaborating on projects that's going to help help us to get towards a manageable solution, so that we can stem the tide of a lot of potential even further crises down the road.
And to speak concretely, so the salaries that we're talking about are anywhere from $28,000 to $32,000 a year. That's what we're talking about. Generally, you're looking at anywhere from like $700 to $1,000 on a bi-weekly basis. The reality of the case, that doesn't sustain a household. Someone making that money is probably, they have other members in their family. They're probably dealing with their own health conditions. That's generally the profile that we're looking at. There was an article or a report on the progress of America. It talked about how long communities of colors kept their money. Black communities kept their money for 30 minutes. 30 minutes. Latino communities for 45. What does that mean? That, to me, what that points out is there's no way for us to even invest in our own communities when we're just sustaining ourselves at the bare minimum. And that's the reality of what we're dealing with. I was looking through some reports, and I was looking at how my dollars, helped out, residents in Orange County. And I've noticed that the amount of assistance, even though it's gone up, that I've provided, it's kind of kept it at the same level with the amount of people that we're serving. So, so for example, like if last year I served, or 2 years ago I served 40 people, now with the same money I'm serving 37, because of the increase in the rents and the lack of property out there for affordable property for the people.
Thank you, Hector. So Melissa, any other questions? I don't see any at this
I just
point.
wanted to share the question. Actually, it makes me think of, I watched this webinar the other day, early this week, where the speaker talked about solutions to housing, and they like categorized their solutions as like 3 S's of solutions to housing. And they talked about supply, so like creating more housing; stability, which is like preserving the existing affordable housing; and then subsidy, which is about, creating those opportunities for people who have no access to housing to have access. So supply, stability, subsidy. And I think like, that this question in particular talks on that like subsidy piece. And what you're all saying, it just makes me think about that dynamic of how we can't really deal with this housing crisis just looking at one type of solution. They're all touching on each other. There is this domino effect. And so we can't, for me, the idea of a minimum income sounds awesome, but it's also like that solution exists in a world where there are all these other problems happening at once. So we have to think about all those pieces together.
Yeah, absolutely. I would agree. You cannot, housing issues are very complex, and you can't just look at one aspect of it. And I like this supply, stability, subsidy. That's, but I think you can't look at supply and supply alone, and you can't look at stability and stability alone. And certainly, subsidy is not a long term for everyone. It's just not. You want to be as independent as possible and as stable as possible. But the current market, we don't have that, and I think that's what we need to work towards. Looking at all of these aspects, which is again why I think every agency has a role to play. Maybe your agency cannot play a role in subsidy, but perhaps in stability, perhaps in supply, and ultimately every single one of us as individual certainly have a voice.
Thank you. So we do have a couple more minutes. Does anyone else have any questions for our wonderful panel?
I just want to thank our panelists. This has been so interactive, probably one of the most I've ever been on. And I just really appreciate all of you engaging in everything in this. It's really important. And obviously there was no one solution. It does take a village. But thank you very, very much. I appreciate all of your time and input into this.
Thank you.
Yes, thank you to all the panelists. Thanks for all the questions. I think we all realize that, again, it's not a one-side issue. There are a lot of things. I think in Naudi's presentation before kind of laid the foundation to this discussion, and there's certainly a lot of more work to do. So I encourage everyone to dig a little bit deeper, try to connect with your local community organizations, try to do what you can to kind of build that knowledge around not only housing, but the determinants of health, because I think it's all interrelated, and, you know, obviously see where you fit in that puzzle and how can you help. So again, I appreciate everyone coming out. Panel, thank you. Really appreciate it. And we'll kind of go from there. Melissa, I'll hand it over to you.
Thank you. Thank you, Freddie, and to our exceptional panel, to Colin, Terri, Sabrina, Patience, Hector, Javier. Let's give them all a round of applause.
Thank you.
Thank you. That definitely gives us a lot to think about, a lot to add into our, upcoming request for proposal, and just really, like Jeannie and Freddie said, just an incredible and engaging conversation. The majority of folks have stayed through the day, and if you've been monitoring the chat box, we've had over 100 comments. Lots of resources shared, lots of questions, concern, feedback. Like Jeannie said, it takes a village, and focusing on those social determinants of health. We're all working together to help our community through this extremely uncertain time. So I just want to say that this information is just so invaluable, and as we discern our funding strategy for the coming year, and just thank you all so much for your insightful comments and feedback. Before we take our next 2-minute break, because we're not done, we still have an exceptional presentation coming up from Marist College. I want a show of hands in this virtual world, world that happened 8 months ago now, which is wild to say 8 months ago. How many of you have had some trouble getting your message out? It's different, right? Show of hands, it's a little different. Yeah, we all have, right? So we're going to be giving you some actionable tools from our Marist specialists in just a couple minutes about how folks can get their message out in this virtual and different environment. So I'm going to give you 2 minutes. It is now 11:21, so we will reconvene at 11:23, and then I will turn it over to Dr. Damiano and her team.